Good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about electrodes used in kinesiological EMG and its working. So while choosing electrodes, usually the electrodes are electrically conductive material, which acts like an antenna. So there is a detection zone having volume with R proportional to electrode radius square. Records the biological signals EMG, ECG, EEG. The role of electrodes basically these transform the ionic signal resulting from sodium and potassium ion transport into the electrical signals. Biological material between muscle and electrode and its thickness act as a low pass filter. It also attenuates the high frequency portion of the detected signal. Surface electrodes. Detection of electrical signals arriving at skin surface. Advantage: it is non-invasive, no discomfort, but there are some disadvantages like crosstalk from other muscles and neighboring muscles possible to reduce. Deep muscles, not much reduction is possible. So typical application in sports, work, studying big strong superficial muscles. Next, indwelling or needle electrodes. So direct measurement within the muscle. Advantage: possibility to investigate the individual motor unit potential and possible to locate the activity of deep small muscles or weak contraction, less signal interference and more sensitive to fatigue. Disadvantage: pain and limit application in fatigue or rehabilitation studies. Contraction may change the wire position and risk of contamination. So use when studying a deep muscle or specific disease. So next we are having the how to prepare electromyography action list. Like, ask your subject to wear the appropriate clothes and decide for a navigation technique to identify the location or landmark prominent region. Clear the skin with conductive fluid, then attach the electrodes parallel to muscle fiber, approximately 2 centimeter electrode distance. Use small electrode type. So now wait for at least 3 minutes and use time to stretch, warm and prepare subject. Then connect and secure cables. Ask the subject to lay down on a bench and relax. Next, start the signal monitor and check each EMG trace. Then check EMG activity bus. So kinesiological EMG needs a movement trigger. Like any meaningful interpretation of EMG needs clear understanding of movement or activity that produced an EMG finding, especially the contraction position, joint angle or muscle length, or contraction phase, that is extension or flexion, is important to determine. The ratio to movement phases and positions is typically arranged by event markers. So movement events are movement start and end, point of return within repeated movement cycles, external stimulation within evoked potential test, physical provocation to test muscle reflex response, and heel strike and toe off gait cycle. So a test within a reproducible static or joint position, which is the easiest and simplest way to determine the movement position. There is no special marker or trigger routine is needed. So as shown in the figure also. We can also add the manual marker line in real time. So place markers in your record to indicate start or end of a movement phase for slow movement only. We can also use the synchronized video imaging. Like regular or high speed video can be synchronized to EMG recordings to allow event definition. We can also use the goniometers, inclinometers, or accelerometers on subject or built-in machines. Mobile sensors can be attached to subject will be recorded together with EMG. We can also use the force plate or contact plates. Foot switch are mounted below the feet in gait analysis, or contact plates are used in jump testing also. Apply the foot switches. Foot switches are mounted below the feet in gait analysis, or contact plates are used in jump testing. Thank you.